discuss about the McCowell syndrome and familiar cold autoinflammatory syndrome. So both are belonging to CAPS or cryopyrin associated periodic syndrome. Then these rare disorders are associated with heterozygous mutation in here in NLRP3 or CIA-SI gene. So this gene encodes protein, NALP3 or cryopyrin, and inflammation driven. Why? Because of the excessive production of cytokine interleukin 1 beta. So again, this gene encodes protein, cryopyrin, and inflammation due to excessive production of this cytokine. So there is NLRP3 mutation is autosomal dominant, meaning if one parent has the NLRP3 mutation and it is passed on genetically to the child now will have CAPS. So 50% chance that parent with CAPS will pass the gene mutation. Dominant and LRP3 mutation does not require two parents to have mutation in the offspring. Only one person with mutation can cause CAPS to be passed on next generation. So mechanism of the effects. So mutation in NLRP3 or CIA-SI cause this gene mutation or genetic disease. So NLRP3 gene gives instruction for making a protein called cryopyrin. So what is cryopyrin? Cryopyrin belongs to a family of nucleotide binding domain enzymes which repeat containing protein and involved in the assembly of a molecular complex called inflammasome. So I will write inflammasome. That process inflammation. What am I? So inflammation occurs when the immune system sends a signaling molecules and WBC to an injury or disease to fight microbial invaders and facilitate tissue repair. When this has been accomplished, the body stops inflammatory response to prevent damage to its own cells and tissues. So, simply the mechanism of defense. Recurrent short self-limited episode of low-grade fever, then rash precipitated by exposure to cold temperature. Other common symptoms are conjunctivitis, muscle pain, profuse sweating, drowsiness, headaches, nausea, extreme thirst. Yes, there. And severity of crisis correlates with the intensity of the cold trigger, usually during winter. So, early onset of disease is at the birth and within the first 6 months of life. So, late onset renal amyloidosis was reported. Deafness and amyloidosis are not observed in FCAS, but can observe in WS or Michael-Wells syndrome. MWS are characterized by recurrent episodes of fever and rash associated with joint and eye manifestations. Episcleritis and iridocytis, headache, and papilloderma have been reported in some cases. Deafness is common in 70% of the cases. It begins in childhood. Then amyloidosis is the most serious complication of MWS.